The Alabama Department of Public Health's mission is to protect the health of the citizens of our state. And to that end, we have for many years developed plans and programs for a time such as this. It's extremely important for us to realize that many of us have spent our entire careers working on such activities as these. With the Alabama Department of Public Health, we have our Center for Emergency Preparedness. We have our healthcare coalitions. That's part of the reason we have such a large audience today, is we're actually doing an exercise on another preparedness issue with our healthcare coalitions. We have our Serious Infectious Disease Network, and we have our Hospital Preparedness program, which not only provides training with our community partners, including our hospitals, our EMA, our first responders, but also does off-site training, as we fondly call road shows, coming to communities and counties throughout the state of Alabama in order to provide training, again, for response to public health emergencies. Now, again, as I mentioned, we plan, we train, we exercise, we educate. And as part of this multi-layered approach, in conjunction with many of you in this room and the community leaders that are behind me, we can take this multi-layered approach and scale to the situation that we need to respond to. We have to look back on experience here, and let's just talk about what's happened in this century. For example, we dealt with SARS in about 2002, 2003. As the mayor mentioned, H1N1, I was involved in that. Let's move forward a little bit. Another coronavirus, the MERS virus, is a virus that we worked with, and we scaled information, and we trained, and we exercised, and we responded. And even more recently, the situation related to our Ebola response in not only the United States, but also in Alabama. And again, I want to remind everyone that these kinds of plans, this training, these exercises can and will be and have been modified in each one of these situations to address the emergence of the disease that is of concern at the moment. Now, I want to talk a little bit about the COVID-19. The COVID-19 is actually a coronavirus. It's part of a family of coronaviruses, and it is one of 7 coronaviruses that can infect humans. There actually are other coronaviruses that cause common colds, and those are in the United States already. Again, I'm talking about the non-COVID virus. And then I mentioned MERS, and I mentioned SARS. Those are coronaviruses too. And COVID is a coronavirus. Now, it's very important to be aware that coronaviruses, as any respiratory virus, are transmitted by respiratory droplets. And these droplets, again, are transmitted into the air by people coughing and sneezing. The droplets can only go about 6 feet. So with that being said, we have to remind that just a level of distancing can be a way to reduce the spread of this. Again, what we know about COVID today is that it is appearing to be spread by respiratory droplets. And as part of that, remind ourselves that we do know measures to reduce this, and I will talk about those in a moment. Now, talking about the range of illness, again, I mentioned the non-COVID coronaviruses that can cause respiratory illnesses. And let's talk about what we know about COVID right now, which is that it also can range in severity. COVID can range from a mild respiratory illness to a more severe respiratory illness, including pneumonia. There have been no deaths in the United States related to COVID-19. As this situation continues to develop, we will continue to monitor this. Now, I've talked about plans, and I've talked a little bit about the COVID virus, and let's talk just a moment about preparedness before I move into talking about what the community can do. Now, in terms of preparedness, the Alabama Department of Public Health has a robust surveillance system, and it would take me a while to explain surveillance to everyone, but I'm happy to answer questions if needed regarding what that means. But we have a robust surveillance system for communicable diseases in the state of Alabama, not just COVID. There are other diseases that are reportable in Alabama. These diseases, again, we get this information from various sources, and when we receive this information, we follow up and respond in order to protect the public's health. For example, many of you are aware that we have hepatitis A in the state of Alabama, and we receive that information as part of our surveillance, and we respond in manner related to that disease. As part of this situation related to the COVID virus, the Alabama Department of Public Health remains in regular communication with the CDC, and we have talked to them by landline, by cell phone, by email, by text. Again, we have a direct line, and we can receive information. I can call and compare notes if we have a question related to a situation, talking to other physicians. This is what I have, what do you think, so that we can put the best minds together to make the best decisions and to provide the best information to the citizens of Alabama. We also have a movement and monitoring system in place. Again, it's fairly extensive, but just to be aware, if we have persons coming in to Alabama that have been to countries that have widespread coronavirus, COVID, again, COVID-19, we receive information regarding who those persons are. We have a tracking system. We have a follow-up system. Again, it's a very robust system. I was talking to one of the nurses about it this morning. So again, we have our movement and monitoring system. So again, there is a lot of surveillance, there is a lot of monitoring, and there is a lot of discussion to ensure that we stay up to date. The last thing I do at night is read about COVID. And the first thing I do in the morning is read about COVID, because we want to stay up to the minute in the Alabama Department of Public Health. And my colleagues in the Alabama Department of Public Health and our partners, many of whom are in this room, are staying same time with this virus, so we can respond in the best way to protect our citizenry. Now, finally, I've talked about all of our plans, our training, our exercise, what we know about COVID. What does this mean to the general public? Well, I'm a citizen of the state of Alabama, and my daughter and son-in-law live here in Huntsville, Alabama. And so I want to spread the message and remind people that the first thing that our citizens can do, we have very smart people in the state of Alabama, and our citizens, first of all, can educate themselves from vetted sources. For example, the Alabama Department of Public Health has a coronavirus webpage. The CDC has a wealth of information on the coronavirus, and this is changed and updated as needed. In addition to that, to remind ourselves, go back to, this is a respiratory virus. What do we do to reduce the risk of respiratory viruses, other respiratory viruses? Well, first of all, we need to be aware to wash our hands or use hand sanitizer. Wash our hands, for more than just, running them under the water. I have the Happy Birthday song that I sing a couple of times when I know you all don't want me to do that. We cover our cough. We use our respiratory etiquette, cover our cough into our sleeve. Again, when we're ill, we should stay at home. We should take the advice of our healthcare providers, our doctors and nurses. Again, I'm a physician myself. I like for patients to follow my advice. Again, that advice could be over the phone. In this kind of situation, we do not want or need people with mild respiratory illnesses going to our hospitals and taking spots in the emergency room that need to be allocated to people having heart attacks, strokes, illnesses of that nature, or should we have a COVID patient. We want to make sure that we use our medical resources appropriately. Finally, I remind people we're still in the flu season, and while the flu vaccine is not perfect, and in some years the effectiveness can only be about 50%, 50% is better than no percent. So again, people should have their flu shots, because that really helps us should we encounter a patient that has been in an area of concern to know that they've already been vaccinated, and we can do a respiratory panel and determine, do they have this virus? So flu shots are extremely important, and I really can't stress that enough. And then finally, for all of us, we live in a state that has tornadoes, and I know you may think tornadoes, how does that relate to this? Again, back to H1N1, in situations of other concerns. All of us should have a personal preparedness plan, and there is a wealth of information not only on our website. We have what we call our Get 10 plan, Get 10, and that's on our website, and it's actually very helpful to me. I've handed this out to my family members and said, okay, be prepared. If an event happens, if a situation happens, these are the things you need to have available in your home. This is what you need to be able to do. You need to be able to communicate with your employer, communicate with your schools, and again, have plans and follow plans. And this is not anything new. This is something that all of us should have as individuals, so that in an event where we might have a situation such as this, and we might have a decrease in the ability to be out in the community, we should have our own plans and our own preparedness. At this point in time, we have the ability to respond to this. We have the experience to respond to this. We are staying up to date on the information. And when we partner, not if we partner, but when we partner with the people in this room, with the community leaders, with the hospitals, with the physicians, with the nurses, with our first responders, our police department, and our firefighters, thank you so much for the service that you provide, with our EMAs, with our EMS, and again, our other people involved, such as our school systems, our businesses, etc. When we partner and when we work together, we're stronger. We can get through this if we continue and when we continue to work together. Thank you so much.